Hi, I'm Dr. Justin Greenslade, an upper gastrointestinal and bariatric surgeon based in Brisbane, Queensland. I'd like to talk to you just now about the available surgical options for weight loss. As we all know, obesity is becoming an increasing problem across the world, particularly in the Western world, and Australia is no exception from that. And weight loss surgery does remain the most effective and durable means of treating obesity. So I offer three particular operations for weight loss purposes, being the sleeve gastrectomy, the single anastomosis gastric bypass, and the Roux-en-Y gastric bypass. The process surrounding these operations is all fairly similar. We often ask patients to engage in a very low-calorie meal replacement diet in the lead up to these surgeries to help shrink the liver down. Patients are in hospital, typically for 2 nights, and then you engage in a progressive phasing in dietary process in the 4 to 6 weeks after the surgery to get back to the solid foods. The operations themselves are all laparoscopic or keyhole surgeries, so recovery from these is fairly quick. The sleeve gastrectomy is the simplest of the operations, and what we're doing with this procedure is basically taking away the outer part of the stomach. So we're turning the stomach from a 2-litre sac-like structure into more of a banana-shaped tubular structure. So that has the effect of pulling up the amount that people eat at each sitting. It reduces overall intake, but it also triggers changes at a gut hormone level, which helps with things like appetite control and better blood sugar control. So it's a very potent tool for weight loss, and it remains the most common operation that we do for weight loss. The next step up from that is the single anastomosis gastric bypass. This operation involves the sectioning off of a tubular pouch of stomach, sort of like the top 2/3 of a sleeve gastrectomy, using a stapling device. But then a long loop of bowel is drawn up and joined onto the bottom of this pouch to re-establish continuity. So food will pass straight from that gastric pouch into the next part of the bowel. So the operation still primarily works by pulling up the amount that people eat, but the diversion of the food stream away from the rest of the stomach and the duodenum also triggers changes at a gut hormone level. And that again helps with appetite control and improved blood sugar control. The operation perhaps has somewhat more weight loss potency and durability compared to the sleeve gastrectomy. But if the patient does have severe gastroesophageal reflux, it's probably best not to have this operation. We would suggest the Roux-en-Y bypass. Nonetheless, this operation has a very effective weight loss outcome, and you do need to make sure that you maintain vitamin intake with this operation, and having appropriate support from allied health support such as dietitians remains very important. The classic Roux-en-Y gastric bypass has been around the longest of all of these operations. It's been around for about 55 years now. It became a laparoscopic operation in the early 90s and gradually reached greater acceptance as a result. With this operation, again, we're separating off a small pouch of stomach with the stapling device. Bowel is also drawn up and joined onto the bottom of this pouch, but there is a second join further downstream, which allows the digestive juices and bile to meet up with the food, and then digestion continues in earnest beyond that point for the remaining 2 or 3 meters of bowel. This operation has particular use in patients who do have severe gastroesophageal reflux, as it's diverting the acid and bile further downstream, tends not to make its way back up the esophagus to reach, back up the bowel to reach the esophagus. As always, allied health support is important with any of these operations, and vitamin intake is very important. If you're interested in any of these surgical approaches, I would be very happy to touch base with you and go through your options and see which of these procedures would best suit your purposes. Thank you.